Hello friends, welcome to Harrison Internal Medicine readings. Today we are going to see second page. Scattered petechiae and a faint diastolic murmur or a small mass in the abdomen is not a quiet question of keener eyes and ears or more sensitive fingers, but of a mind alert to those findings. Because physical findings can change with time, the physical examination should be repeated as frequently as the clinical situation warrants. Given the many highly sensitive diagnostic tests now available, particularly imaging techniques, it may be tempting to place less emphasis on the physical examination. Indeed, many patients are seen by consultants after a series of diagnostic tests have been performed and the results are known. This fact should not deter the physician from performing a thorough physical examination, since important clinical findings may have escaped detection by the passage of prior diagnostic test. The act of examining, touching the patient also suffers an opportunity for communication and may have reassuring effects that foster the patient physician relationship. Diagnostic studies. Physicians rely increasing on a wide array of laboratory tests to solve clinical problems. However, accumulated laboratory data do not relieve the physician from the responsibility of carefully observing, examining, and studying the patient. It is also essential to appreciate the limitation of diagnostic tests by virtue of their impersonal quality, complexity, and apparent precision. They often gain an aura of certainty regardless of the fallibility of the test themselves. The instruments used in the test and the individuals performing or interpreting the test. Physician must weigh the expense involved in laboratory procedures against the value of the information these procedures are likely to provide. Single laboratory tests are rarely ordered. Instead, physicians generally request batteries of multiple tests, which often prove useful. For example, abnormalities of a hepatic function may provide the clue to non-specific symptoms such as generalized weakness and increased fatigability, suggesting a diagnosis of chronic liver disease. Sometimes a single abnormality such as an elevated serum calcium level points to particular disease such as hyperparathyroidism or an underlying malignancy. The thoughtful use of screening tests, measurement of low density lipoprotein cholesterol may be of great value. A group of laboratory values can conveniently be obtained with a single specimen at relative low cost. Screening tests are most informative when they are directed toward common disease or disorders and when the results indicate whether other useful but often costly tests or interventions are needed. On the one hand, the biochemical measurements together with a simple laboratory determination such as blood count, urinalysis, and erythrocyte sedimentation rate often provide a major clue to the presence of a pathologic process. On the other hand, the physician must learn to evaluate occasional screening test abnormalities that do not necessarily connote significant disease and death in work up after the report of an isolated laboratory abnormality in a person who otherwise is almost invariably wasteful and unproductive. Because so many tests are performed routinely for screening purposes, it is not unusual for one or two values to be slightly abnormal. Nevertheless, even if there is no reason to suspect an underlying illness, tests yielding abnormal results ordinarily are repeated to rule out laboratory error. If an abnormality is confirmed, it is important to consider its potential significance in the context of the patient's condition and other test results. The development of technically improved imaging studies with greater sensitivity and specificity process apace. These tests provide remarkably detailed anatomic information that can be pivotal factor in medical decision making. Ultrasonography, a variety of isotopic scans, CT, MRI, and positron emission tomography have supplanted older, more invasive approaches and opened new diagnostic vistas. In light of their capabilities and rapidity with which they can lead to a diagnosis, it is tempting to order a battery of imaging studies. All physicians have had experience in which imaging studies revealed findings that lead to an unexpected diagnosis. Nonetheless, the patient must endure each of these tests, and the added cost of unnecessary testing is substantial. Furthermore, investigation of an unexpected abnormal finding may be associated with risk and/or expense and may lead to diagnosis of an irrelevant or incidental problem. A skilled physician must learn to use these powerful diagnostic tools judiciously, always considering whether results will alter management and benefit the patient.